take you through the neonatal resuscitation program in a step-by-step exam-oriented way. This session is especially useful for NEET PG and INI-CET aspirants, but also for anyone revising neonatology. In the next 30 to 40 minutes, we will go through the algorithm, key drug doses, and the special scenarios, and finally summarize the whole concept. Here's what we will cover today: initial assessment and APGAR scoring, airway management and ventilation, chest compression and drugs, IE pulse and mnemonics, and finally, we end up the session with quick summary. Let's begin with the initial steps of NRP. Before going to that, let me ask you a question. Imagine there is a newborn just delivered. What are the three important questions to be asked? So, as soon as we want to speak about the neonatal resuscitation or NRP program according to 2021 algorithm, every time the antenatal counseling, team briefing and equipment check is very important. As soon as the birth of the baby, three important questions are asked. That is the baby a term baby? Is the baby crying or breathing? Does the baby have a good tone? If all these three are yes, then follow routine newborn care. If any one of this is no, then immediately go for initial steps of resuscitation, which is remembered with the mnemonic warm pads, where warm refers to radiant warmer. Pads may P stands for position and A stands for airway. That is, the baby should be put up in slightly extended position. How do you do this? By placing a shoulder roll or a roll just beneath the shoulder so that the head is slightly extended. Then A stands for airway assessment. Then D is like drying the baby, and then gentle stimulation of the baby. Suction only if required, and always mouth is followed by nose suctioning should be done. After these initial steps of resuscitation, we have to check if the baby is still apneic, gasping, and the heart rate is less than 100. If none of this is present, then it is a prolonged cyanosis or a labored breathing. We should check for respiratory distress. We have to monitor the saturation and connect the baby via oxygen, CPAP, position the airway, and monitor oxygen saturation by pulse oximeter. If apnea, gasping, and heart rate is present, matlab less than 100 is present, then go for positive pressure ventilation. What are we supposed to monitor here? Pulse ox to be connected and cardiac monitoring to be done. And all of these things from questioning till positive pressure ventilation to be done within 1 minute of duration. And the best indicator of effective positive pressure ventilation is increasing heart rate. If the heart rate is less than 100, then go for ventilator corrective steps. What are these? These include MR-SOPA. What is MR-SOPA? M stands for mask readjustment and R stands for repositioning the airway, that is slight extension of the head of the baby. Then we have to do suctioning, always mouth followed by nose suctioning. Then open the mouth and do jaw thrust forward. Increase the pressure of positive pressure ventilation, that is up to 40 centimeters of water. Even if the heart rate is still less than 100, then go for alternative airway, that is laryngeal mask airway or endotracheal tube should be placed. Then check for heart rate after doing all the ventilatory corrective steps. If heart rate is less than 60 again, then we have to start on chest compression. How do we do chest compression? This should be in a ratio of 3:1. That is, chest compression should coordinate with positive pressure ventilation. 3 chest compressions with 1 positive pressure ventilation where 100% oxygen should be used. Now let us know more about chest compression. What is the indication of chest compression? Heart rate less than 60 despite 30 seconds of effective positive pressure ventilation, immediately go for chest compression. What are the techniques that is available? There are two types of techniques. One is two finger technique and the other is two thumb technique. But two thumb technique is more preferred as compared to two finger technique. In two finger technique, two fingers are placed in the lower third of the sternum and the compressions are given. Whereas in two thumb techniques, the thumbs of both the fingers are placed in the lower sternum and the compressions are given. The ratio is 3:1 where 3 compressions and 1 positive pressure ventilation is given using 100% oxygen. After this, we have to check for heart rate again. If heart rate is still less than 60, then immediately we have to start the baby on medications. What are the medications that is to be used? So medications, basically the important one is adrenaline. What is the indication for using adrenaline? Heart rate less than 60 despite 1 minute of chest compression is an indication for starting on medications. What is the strength to be used? 1 in 10,000 either intravenously or intraosseously it can be used. Dose of it, if it is used intravenously or intraosseously, 0.2 ml per kg to be done. Intratracheally 1 ml per kg to be used. Even after giving medications, if heart rate is still less than 60, repeat the medication every 3 to 5 minutes. Check for heart rate again. If still less than 60, consider alternative diagnosis like pneumothorax or hypovolemia. Now, let us rapidly revise neonatal resuscitation before going to APGAR scoring. So basically, in neonatal resuscitation according to 2021 algorithm, first thing that is to be asked is about the antenatal counseling to be done, team briefing to be done and equipment checkup to be done. As soon as the birth of the baby, ask for 3 questions. If the baby is a term baby, what is the tone of the baby and did the baby cry immediately and is breathing? If all of this is yes, then start routine newborn care, that is baby to be placed with the mother, rooming in which is called as, and breastfeeding to be started. If any of this is no, then initial steps of resuscitation to be started, which can be remembered with the mnemonic warm pads. That is radiant warmer. The baby should be placed in radiant warmer. Position the airway. The baby should be slightly in an extended position. And then dry the baby. Then gentle stimulation to be done by rubbing on the back and suction if required. Always mouth followed by nose suctioning to be done. After these initial steps of resuscitation, we have to check if the baby is having apnea, gasping, and heart rate less than 100. If any of this is present, then go for positive pressure ventilation. If not, then it is a case of prolonged cyanosis or labored breathing. Then check for respiratory distress, connect the baby on oxygen, CPAP, position the airway and pulse oximeter. If apnea, gasping and heart rate is less than 100, then go for positive pressure ventilation. Monitor the baby by saturation by pulse oximeter and connect monitor, cardiac monitor to be connected. Best indicator for effective positive pressure ventilation is increased heart rate. All of these steps to be completed within 1 minute of birth. Even after positive pressure ventilation, if heart rate is less than 100, then go for ventilator corrective steps, that is MR SOPA. MR SOPA means mask readjustment, repositioning the airway, that is slight extension, suctioning, always mouth followed by nose, open the mouth, that is jaw thrust forward. Increase the pressure, that is up to 40 centimeters of water. Then alternate airway can be considered if heart rate is still less than 100. That is laryngeal mask airway or ET tube insertion can be done. Then heart rate is less than 60 even after ventilatory corrective steps, then immediately go for chest compression. Indication for chest compression itself is heart rate less than 60 despite 30 seconds of effective positive pressure ventilation. We have two important techniques, two finger technique and two thumb technique. Two thumb technique is most preferred as compared to that of the two finger technique, and the ratio of chest compressions is 3:1, that is 3 chest compressions and 1 positive pressure ventilation with 100% oxygen. If heart rate is less than 60 even after chest compressions, we have to start them on medication. What is the medication of choice? It is adrenaline. Heart rate less than 60 despite 1 minute of chest compression is an indication for starting adrenaline. Strength of it is via intravenous or intraosseous route 1 in 10,000. Via intravenous or intraosseous, we have to give 0.2 ml per kg. Intratracheally 1 ml per kg can be given. Repeat the medications every 3 to 5 minutes. If heart rate is less than 60, then consider the alternative diagnosis, that is pneumothorax or hypovolemia. Bag and mask ventilation is contraindicated in congenital diaphragmatic hernia. So we have to directly intubate the baby. What is the reason? Because in congenital diaphragmatic hernia, already the bowel loops are present within the thoracic cavity due to defect in the diaphragm. So if we are going to give positive pressure ventilation by bag and mask, we are going to increase the air entry into the bowel, leading to further lung compression, which is going to worsen the condition, hence it is contraindicated. Now let us study about APGAR scoring. So